Hi, Dr. Tracy Tyson, pediatrician. Let's talk iron deficiency. Did you know that babies are not born with their normal amount of hemoglobin? They have to make it all within the first few months of life. So they're born with something called fetal hemoglobin, which only works when they're inside their mother. Once they're outside their mother, they really need to make adult hemoglobin. That takes a lot of extra effort. And so those first few months of life, it's really important that children get enough iron. They can get it in breast milk or infant formula. So we really want to make sure that there are no iron-free formulas out there. So if you're buying a formula from another country, double check that there's iron in it. So that's what the babies have to do the first few months of life. And then after that, they have to triple their birth size. So they need so much extra iron in order to make that many red blood cells. Why is that important? So hemoglobin and the red blood cells actually take oxygen, carry them throughout your body. You need oxygen for your cells to thrive. Not only do baby cells need to thrive, they need to multiply, and they need to multiply by many with all of that growth, all the differentiation that happens in the brain cells. So when babies don't get enough oxygen because they don't have enough iron, they can actually have problems with their brain growth. Children used to have cognitive impairment, not be able to reach their full potential because of iron deficiency. So once we learned this way back in the 1920s, 1930s, really started pushing for extra iron in children. That's why infant formula has extra iron in it. That's why if you look at cereals, they're iron fortified. Rice cereal for babies, iron fortified, oatmeals, grains, all of those things were fortified with iron so that babies in the United States could get extra. So when we check for this in the pediatrician's office, we screen every child between the age of 9 months and 1 year to make sure that there's not iron deficiency, because it's not always obvious when you look at the baby. Again, they all look the same that first year of life for so many different reasons. So we double check to make sure that your baby is not iron deficient. We do it so early that there would be no chance that we would allow there to be any problems with their cognition or their ability to learn because of this. So when your pediatrician wants to poke your baby's toe at a year, you don't want another poke. Remember, one poke to find out if your baby is iron deficient can be the difference between them reaching their full potential and then not. So I hope this helps someone understand why we're doing what we're doing. Ask the questions. Ask your pediatrician how to get enough iron in your kid's diet. What are the best feeding sources for your kids? Take care.